Hi, my name is Zoe zcoloma. My D number is D4107505. Here's my badge. Today I'm going to go ahead and cover NR224 skills checkoff for fundamentals, and I'm going to cover tracheostomy, suction, and care. I'm going to go ahead and get started. Knock, knock. Hi, my name is Zoe. I'm going to be your nurse today, your student nurse today. I'm going to go ahead and cover and do a tracheostomy care and suction on you. Is that okay? Patient's going to state that it's okay. It's going to take about 10 to 15 minutes. Is that okay? Patient's going to state that it's okay. I'm going to ask them how they're feeling today. Patient's going to state they're okay. I'm going to ask, I'm going to identify the patient's name and date of birth. Patient, what's your name and date of birth? Patient's going to verify name and date of birth. And then I'm also going to ask the patient if they have any allergies, medication allergies, or latex allergy. Patient's going to state no to both. I'm going to also ask the patient if they're in any pain. From 0 to 10, 10 being the worst. Patient's going to state no pain, which is a 0. Going to make sure that the door is shut and the curtains are shut to provide privacy for the patient. And I'm going to go ahead and set up my supplies on a clean surface. I would not do this on a patient's chest or on the body. I would do it on a separate tray for video purposes. I have it set up here. Okay, so I'm going to go ahead and auscultate the patient's lungs, make sure that everything is good, and then also determine which nair to use for the suction catheter. I would also be verifying the doctor's orders, and I would make sure that I'm going to go ahead and start setting up the patient. So I'll go ahead and set the patient upright in bed, which is a semi-Fowler's or a Fowler's position, and I'd make the bed at hip level, and then I would also raise the bed at hip level, and then also lower the rails on my side. I would drape the patient's chest over the patient's chest, and then I would do hand hygiene. I'd also like to note that I do have a suction canister and tubing here, and then I do have an ambu bag that's going to be set to 100%. This is going to be hooked up to the oxygen as high as it can go, which is, in my case, it's going to be 12 liters. I have a suction catheter that's going to be set to 100 to 120 milliliters of mercury on continuous suction. Now that I did my hand hygiene, I'm going to go ahead and open up my sterile saline. And I'm going to go into my sterile saline kit, my cleaning kit. I'm going to take this out for now, which is my tracheostomy care tray, which will be done and used on the second part of my video. So this is my suction catheter kit. Opening it out and away. And just repositioning this for now. I'm going to grab my sterile gloves. I'm just going to open this up. Grabbing my gloves, dominant hand inside, never touching the outside over here, hands above my waist, just scooping out, and hands above my waist at all times. I'm gonna go ahead and grab my box here. Please note that this is going to be a sterile surface, and I'm going to be using this sheet to place everything. So I'm going to grab my box here. I'm going to remove the plastic packaging that was on it, and then just go ahead and set that there. And then next I'm going to grab my suction catheter from this little baggie, out, toss to the side. I'm going to wrap this on my dominant hand, like that. And then I'm going to move my sterile sheet a little bit closer so you're able to see everything. Next, my left hand here is no longer going to be sterile. I'm going to grab my saline and pour with the label on the facing out, pouring a little saline into my box, and I'm going to go ahead and also connect my tubing to my catheter. And then I'm just going to make sure that my tubing works. I'm going to give it a go here and checking. Shh, shh, shh. Okay, so it does work. And then now I'm going to go ahead and remove the patient's collar, oxygen collar, and moving it off to the side. And now I'm going to go ahead and go in with nothing touching. Hand here, thumb off going in. So I'm going in, and then I'm going to keep going in until I feel resistance. Feeling that resistance, I'm going to pull back by about 1/2 inch, and then again, thumb off going in. I'm going to go ahead and start suctioning in a circular motion. Shh, shh, shh. Okay, pulling out, and then I'm took his air, so I'm going to go ahead and give him 2 breaths. Shh, shh. Again, that was 2 breaths with the ambu bag. I'm going to go ahead and clean off my catheter. Shh, suction, cleaning out. Shh, shh. Okay, and then I'm going to give it a go one more time if the patient needs it. And then, so assuming the patient does need it, I'm going to go back in. Okay, I feel the resistance again, so thumb off going in. Circular motion. Shh. 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 Okay. Taking that out. And then 2 breaths with the ambu bag again. Shh. Shh. Okay. So that's going to be done. I'm done with this. And then I'm going to go ahead and I'd like to note that I have the patient, I have a pulse ox on the patient's index finger. I would say that it's on the left side of the finger, and I've made sure that the pulse, his oxygen did not drop too low. And if it did, I would stop and I would give the patient back his oxygen, and I would have waited and come back a little later in the day. I am going to dispose everything accordingly to my healthcare facility's policy. I would do proper hand hygiene, and I would have made sure that I've auscultated the patient's lungs. I'm not sure if I said that already. I would ask the patient how they're feeling, and then I would also reposition the patient's the patient's bed back to its lower position, bed locked, and I would also make sure that the side rail is back up. I would make sure that the call bell is in reach and ask them how they're doing, and they're going to say okay. Then I'm going to go ahead and document everything before leaving the room. Okay, so I'm going to go ahead and move in and transition into tracheostomy care, and I'm going to go ahead and do the cleaning. I'll do hand hygiene again, wash my hands, and then make sure that the sterile cup is open. Okay, and then to avoid contamination, I'm going to go ahead and start opening up my care, my tracheostomy care tray out and away. Put my sterile gloves on, don sterile gloves. tossing this out to the side and away into the trash. I'm going to move this a little closer to me. And then this hand is no longer going to be sterile. I'm going to go ahead and pour saline into my tray here. And I'm going to start removing my patient's 4x4s here so I can replace it with new ones. How are you doing, patient? Patient stating that he's doing okay. Sorry, there's a little tugging here. Okay, I removed the cannula, and I'd like to note that I did place a new cannula, and I opened it with sterile technique and put it in the my tray before doing all of that. So I would just like you to imagine that I did that. Okay, so I'm gonna go ahead and grab my new sterile cannula that I've placed before putting out, taking anything out, and I did this when I opened up my tray. Anyways, continue. So I'm going to go ahead and put my cannula into the patient. This is my new sterile cannula. And I'm going to start taking out things that I don't need in here. And so there's a few things. I don't need my these pipe cleaners out to the side into the trash. Another pipe cleaner out to the side into the trash. I do need my little Q-tips for cleaning. So I'm going to go ahead and start doing the cleaning. And I'm going to get a Q-tip and then go around. I'm never going in to the patient's cannula. I'm just going inside and around, cleaning it. Okay, tossing out into the trash, grabbing another one, going inside and around. Okay, tossing out into the trash. Those were moist. I'm going to go ahead and dip this into moist. And then I'm going to make sure that I'm cleaning inside and around, never in the cannula. And then flipping this over, using it again, inside and out, cleaning, never inside of the cannula, just making sure it's cleaning inside and around. I'm going to go ahead and dry now. Drying by going in one direction only and making sure that the whole area is dry. And I wanted to make sure that I do this to avoid skin breakdown and never going backwards in only one direction. Making sure that I go inside. Sorry, I just wanted to visualize that it would be inside. I wouldn't do that. I would just do that. Okay. Okay, so now that I've cleaned off and dried the patient and put a new cannula in, I'm going to go ahead and put new dressing. Sorry, patient, I have a little tugging going on. Some tugging going on. Okay, and that's it. So I would verbalize that I would change the security, if I wanted to change the security straps, I would replace the strap and then I would apply one end to the other and then to the new strap, and then on that one side of the trach collar, I would also secure it onto the other end before disconnecting the old strap. And then I would go ahead and reapply the tracheostomy oxygen collar and at the prescribed liters that the doctor ordered. And I would remove the towel from the patient's chest. and position them back into comfort. I would remove my gloves and perform hand hygiene. And I would also raise the bed, lower the bed and raise the rail that I was working on, and then make sure that the bed brakes are on. I would ask the patient how they're feeling, and then also make sure that the call bell is in reach of my patient, or I would just hand it to them, and I would tell them thank you and make sure that I document my care before leaving the patient's room. Thank you.